So how I view integrated care is it's really a series of system transformation efforts that are meant to address some of the big pain points in our healthcare system across the country, really, in helping people and systems really get to healthy communities. So in my mind, the concept of integrated care actually includes multiple components that fit together almost, seamlessly, almost like a jigsaw puzzle. And so integrated care isn't just taking two things and joining them together, but it's taking several concepts and getting them all to work together, as I mentioned, seamlessly. And those things would include working together as a team and sharing tasks efficiently across various team members, while everyone on that team is simultaneously taking a person-centered approach to healthcare, which is really just another way of saying that is just it's also welcoming the client or patient to be part of the healthcare team. And so everybody's working together. But there are also other solutions that fit into that jigsaw puzzle, like I mentioned, and those are things like incorporating measurement-based care. So really tracking your outcomes over time to make sure that you're achieving the outcomes that you're looking for. Adjusting your care so that you're really taking a population approach to care so that you're making sure that nobody in your system is falling through the cracks. And also thinking about things like emphasizing the use of evidence-based practices, and so that you're doing things that you know are effective when those things are available to you. So all of those things all together are what I think of as integrated care. That's my definition of integrated care. So how has COVID really brought some of these issues to the fore? I would say that what COVID really did is it took a lot of pain points that were already present in our healthcare system and made them more acute and more apparent. We saw really dramatic shifts in not only the behavioral health and primary care workforce, not only shifts in how many we had and where they were, but also how they had to do their work. So even before COVID happened, we already had and have a dramatic workforce shortage for behavioral health clinicians. We just don't have, and really never will have, the number of behavioral health clinicians that we would like to see all across our country. Most communities experience a dramatic shortage of behavioral health clinicians, and COVID just made that worse. And so what did we need to do? We needed to, that old cliche of work smarter, not harder, really became very important. We had to take all those principles of integrated care and apply them, as well as we had to shift from providing services in person and on premises and having to do them in more remote locations and using telehealth. So of course the concept of telehealth really exploded under COVID, and so the other concepts of integrated care, such as how do you provide person-centered care, that's a little bit less challenging when you're seeing a patient in person. It's more difficult when you're seeing somebody over, remote connection. How do you do task sharing when you're two different clinicians on a team deciding who does what? That is critically important when you're doing the services over telehealth, because you really just don't have any time to waste. And all the other principles, measurement-based care, evidence-based care, taking a population approach to care, keeping track of people, all those principles just became that much more important under COVID.